So we are moving into the last hour of our first part of the Dignity of Work Forum. And I will invite my colleague James Houseworth for the next segment.
All right. Can people see my screen here? Second.
Not yet.
Oh, hold on. I didn't hit the share part. I was just getting the. Okay, there we go.
Yep.
Thank you. Okay, so my name is James Houseworth. I'm from the University of Minnesota Institute on Community Integration. And I'm going to be presenting today on the state of community employment among people with intellectual and developmental disabilities in the United States. So first of all, I just want to acknowledge this is part of a book chapter that was co-authored by Windsor, Alberto Migliori, and John Butterworth from the Institute on Community Inclusion at UMass Boston. I also want to thank the host of this event and the book editors, Renata Tika and Brian Avery, and the event facilitator for this event, Nick Fernholz, for facilitating all this for us. So thank you to all those people. So what I'm going to cover today is this is going to be a really broad picture about data, information on the state of employment in the United States of people with IDD. So we're going to cover how, just briefly, how federal policies and advocacy movements, just to lay the groundwork about the federal policy affecting this kind of employment. But really the core of the presentation will be the data sources available and how they vary at the population level, whether about the United States overall, service level, or whether they're actually looking at outcomes important to people with disabilities. And overall, we want you to take away from this how data can provide really rich information about the current state of employment and where there's still work to do, and how there's personal characteristics and other things that we can kind of individualize our understanding of employment based on these national data sets. So first of all, just to lay the land that in terms of integrated employment, the primary provider of both healthcare and community-based services in the United States is the Medicaid services, which is a federal United States-based system. And all of that money is pretty much administered by each state within the states, and that's what funds a lot of the day and employment services. So that's one big source of funding that supports people to go out in the community to do various things. And that's called Home and Community-Based Services, is that waiver that's funded by Medicaid, and that's the largest source of funding for ongoing day and employment services for most people with intellectual disabilities. That's not true for every individual with a disability with IDD, because there's also this other system called vocational rehabilitation services that also that's available to anybody, but that also certainly helps people with disabilities find and maintain employment. It's a more temporary service typically. Home and community-based services are for adults after they leave childhood and transition into adulthood. Vocational rehabilitation, as you can see, often occurs when people are younger in early adulthood, and it's designed to provide short-term services to move them into employment. So another thing to point out about the United States is there is an ongoing, it's really a movement among states called Employment First. And the idea there is that there's all this funding available, maybe not enough, but there is a good, decent chunk of funding available, but it doesn't always lead to employment. It can lead to people staying in some facility-based settings that are unpaid work. So Employment First is kind of saying that basically it affirms that all people with IDD can work in some sort of integrated employment setting with the right accommodations, of course. And that we should prioritize employment-related services over other day programs or facility-based services. So that should kind of be the first goal, because this is an important aspect of being an adult. And it's kind of what we expect of anybody as they're leaving high school and moving into the adult system, that they would work, or that would be a pretty big or primary option. And the last thing about Employment First is that it really affirms that people, that whether they have a disability or not, should follow the state laws of minimum wages. That's been a big controversy. That's a state-by-state decision. But there's still some situations where people with disabilities can be paid sub-minimum wage, and that's legal and allowed. That is ending in a lot of states, but Employment First is a movement to get away from that. So one way to kind of think about what people do during the day related to employment and employment-like things is to kind of look at the breakdown of these four cells. There's paid and unpaid activities. Paid, what we typically call work or employment, unpaid non-work. So on the paid side, there's two situations people with disabilities with IDD find themselves in. One is community integrated employment, what we call CIE. That's kind of, for us, generally speaking, that's the gold standard. That's what we prefer. That's certainly what Employment First is, as I mentioned in the previous slide, is moving towards, emphasizing that as the first and primary option. But there's also people paid that work in facility-based work. These are facilities that are where pretty much everybody working has a disability. They're designed for people with disabilities. They're outside of the community. They're kind of in a silo. They're like an institutionalized setting. They bring in multiple people with disabilities, but they are paid. And this is where you run into that situation where some people can be paid below the minimum wage. And in the past, it's dying off, luckily. But that's where that has been more likely to occur. Then on the unpaid side, you have community-based non-work. This is services for people where basically why this might happen is that they're practicing work-like skills and abilities, and they're going to places that mimic a working environment, but it is unpaid. But these can be in the community, just like the work can, the paid work. But we also have facility-based non-work. So this is where most of the participants have a disability. It's not in the community. They're doing work-like things, but they're not paid for it. So that's going to have a lot to do with how we break down the results here. I'm going to show you as we walk through this. So the first source of data I want to highlight today is called the American Community Survey. It is basically part of the United States Census Bureau. It is a census, so it is one of its big benefits is that it is a population level data source. It's not nearly 100%, but it's the closest you're going to get to 100% because it's a population level survey. So pretty much everyone is asked to fill it out. It's not a sample. It is supposed to be representative of the entire country. And what you can learn from that about the employment of people with IDD can be seen in, there's other, I can't go over it all, but this is one of the big ones, is basically employment rates. And this is a pretty good depiction of employment rates around the country because it is that population level. And you can kind of see here that there's different ways to break this down. One thing to keep in mind that percent unemployed, those are only of people saying that they're looking for work. So that's that row there, B. Row A is kind of what we want. That's the employment rate. That's of the people that would like to work and are looking to work and are adults of working age. That's what percent of them are actually working, have a job. As you can see here, if you look at any disability, 37% of people with any disability are working. So that's your physical disability and other types. People with cognitive disabilities, their employment rate is lower. It's only 30% nationwide. As you're going to see, that's a little bit higher than some other sources of information about IDD, because one drawback of the US Census Bureau information is cognitive disability includes any cognitive disability, which also includes age-related Alzheimer's and other sources of cognitive disabilities. So that is not only people with IDD. That is not able to be broken down only to IDD in this survey. Next thing to point out here that you can learn from this is that if you have a cognitive disability of any kind, which includes IDD, that's a pretty good chunk of this. If you are on Social Security insurance, your employment rate is very low, which is to be expected because in order to qualify for Social Security insurance in the United States, you have to make a pretty good claim that you cannot work, as related to your disability of any sort. So that actually makes sense if you understand that system. So big takeaway here, if you really compare that cognitive disability to no disability, you could see across the board that there's less employment in that unemployment rate for people with cognitive disability. That's the people looking for work is much higher than the people without any disability, almost 4 times higher. Another thing you can get away from the American Community Survey, the census level, is whether people are living, people that are living below the poverty line, whether they're employed or not. And as you can see here, people with cognitive disabilities, 35% of them that are below the poverty line are unemployed. And that's higher than the percent of people with no disabilities. So that's an issue there, and that gets complicated because some services are based on basically being in poverty that for you to be eligible for them. So this kind of creates a system where there's some incentive for some people with disabilities to not work. So that's an issue that you could see from the American Community Survey. The next data source I'm going to go over is called the Rehabilitation Services Administration 9/11 dataset. So this comes from the vocational rehabilitation system across the country. This is the national data set, and this is related to services. So this doesn't really tell you as much about outcomes and so forth, but it tells you of people receiving vocational rehabilitation services, information about that group. So one of the things you can learn from this data set is that of the people receiving vocational rehabilitation services, this was back in 2020, 10% were people with an intellectual disability. So one thing that tells you is that there may be some underutilization of voc rehabilitation services relative to people with other disabilities for people with ID. So that's one thing to keep in mind. Only 10% of those receiving that services reported having an intellectual disability. Most of the people receiving vocational rehabilitation services were between the ages of 16 and 26 years old. So what that reflects is that the vocational rehabilitation system is really coordinating with transition programs, high schools, and some of those early transition programs for people with intellectual disabilities, which is good. That's good that there's some coordination going on there. You could see that with that age. But it does mean that some of the efforts to get people to get a job coach, to work on employment related skills, does really start to die off really quickly when people become 26 years old and older. So there may be some opportunities for people beyond age 26 to get vocational rehabilitation services because they are eligible for it, but those conversations may not be happening. The last thing you can learn from the RSA data set is that people who actually successfully got a job because of this service, and again, this tends to be a short-term service for a period of time, they on average earn 10 or almost $11 per hour compared to higher, almost $15 per hour for people that had other disabilities, including physical and other types of disabilities. So people with ID are exiting that program. The ones that do have jobs are earning less than their peers with other disabilities. So that's an issue with what type of jobs that they're moving into. Another similar thing, number of hours worked. A lot of times when you look at data, people with ID working may have jobs, but sometimes they're not really good part-time or full-time jobs in the sense they're not working a lot of hours and enough hours to kind of support the independence that we know some of them are capable of. So people with ID who works at the VR program work average 22 hours per week, whereas all other disabilities work for 31 hours per week. So it does look like they're getting jobs with less hours available. And the last thing the RSA data set shows you is that states are having different outcomes for people that enter the VR system in terms um, of who's getting services. So, for example, Vermont has a higher percent of ID people who receive services at 93%. So, in other words, the state of Vermont, in some way, is really pushing people into VR services, people with ID. There's some sort of pipeline where they're really encouraging them to take advantage of that service, which is available to them. Whereas the state of Nebraska has the lowest figure, only 34%. So you can see there's a lot of state variation from this data set. The next data set I want to review is the National Survey of State Intellectual Developmental Disability Aids Employment and Day Survey. So this is a survey that comes from the Institute for Community Inclusion, the other ICI, that is out of University of Massachusetts, Boston. This is a product that they worked on over the years. It's commissioned by the Administration on Disabilities. And its goal is to look at community-based employment and day service trends. So they work really closely with the state IDD agencies. So these are the agencies that run ID services to collect this information and other sources as well. This is another national, so this really breaks things down nationally at the state level, and it's really a service level data source. So it tells you a lot about how much what's really cool about this data set is you can really look at differences in how much states are spending of their day services, how much they're actually spending on community-based employment versus those facility and other day activities that are not paid and not in the community. So you can really look at each state and see what proportion of that money they're spending on supporting community-based employment as opposed to those other types of employment or day activities. So what we learned is there has been a growth there's been an overall trend of people moving into community-based employment between 2010 and 2019. It grew by 4%, for example, between 2018 and 19. So that's what we mean by modest. The percentage of individuals was 22% in 2019, so that's up a little bit from 2016. What you can look at this data set and learn from it historically is most of the growth in community integrated employment occurred in the mid 90s into the mid 1980s into the mid 1990s. This corresponds with a lot of federal laws related to disability services and disability rights in the United States, including deinstitutionalization. So that's why that makes sense. That's where you would see the largest increase in this. So it's gone up, but kind of the rate of increase has started to plateau in the 2020s. Between 2004 and 2012, there was a gradual decline in the percent of people with IDD and community integrated employment. So it's kind of hit a little bit of a plateau in some states. And that's something to keep in mind too, is that there's a large variation across the states in participation in community integrated employment. Different states have different opportunities, and each state has a different set of services they make available to people with disabilities. So participation in community integrated employment services does not necessarily mean an individual is employed. That's one thing to keep in mind. From the survey, we learned that states can increase the number of people in receiving those services, but that does not mean they're placing people in long-term community-based employment. That requires a more long-term set of services and situations. There is a lot of evidence that individual states and overall are reducing facility-based work. The number of people in facility-based work and settings is declining. Some states are banning sub-minimum wage, including Minnesota, so that has a lot to do with that. As community-based non-work services continue to grow, more data is needed. So we also need to know more about the quality of those jobs and whether they match the individual. And that's something a lot of every data source I've shared so far doesn't really get at. And finally, the funding for community integrated employment continues to be less than for other activities. So states are still spending a fair amount of money for day programming, for example, where people are going somewhere, whether they live at home with family or whether they live in a group home. A lot of people are participating in programs, and a lot of them are in the community, but they're not work-based programs. They're not community integrated employment. So the last data set that I want to emphasize today is the National Core Indicators, particularly what's called the in-person survey. The National Core Indicators is a measurement program that provides an annual and state-by-state profile of the lives of adults with IDD service users in the United States. So unlike the other data that I have presented so far, this is the one that comes from the person with disability themselves. So these outcomes are individual based. If the person themselves can't answer questions, they do make an effort to find somebody who works with them closely. It could be a family member, could be their case manager, it could be staff, but presumably and hopefully it's somebody that knows them well. And they do make an effort to ask the person themselves when the person is capable of answering. This data source has a lot of information, has a lot of personal demographics. It has health information. And for our purposes, what's really important to know is you can link a lot of information about the person with questions like, are you working? Would you like to work? How many hours do you work? And so forth. So this is one of the ones that we call an outcome level data source. You can get a national picture from it, and you can break it down by individual states. So the kind of information you can get out of the National Core Indicators that I'm going to emphasize today comes from a paper I and some colleagues here at the University of Minnesota and Roger Stancliffe from Australia worked on from 2022 about community-based employment, and this comes directly from the National Core Indicators data set. It was published in the Journal of Vocational Rehabilitation back in 2022. And what we were interested in is here are these 4 cells of the type of day and employment activities people can find themselves in who are on a home and community-based services, with again that idea of community integrated employment. That was certainly our approach, kind of being the gold standard. We don't want a one-size-fits-all approach, but that is kind of a desirable outcome for a lot of people. So we kind of, everything is in reference to that. And we kind of looked at what predicts then. So if you're not in community integrated employment, what predicts you being in these other cells? So what predicts basically, if you think about it, wherever you live, what predicts where a person, an adult of working age with an intellectual disability, what predicts what kind of work or non-work environment are they going to end up in? So these are the kind of questions you can kind of look at with the National Core Indicators. So first of all, don't worry about all the numbers here on this slide. This is just to give you a picture of those 4 types of activities, that there's people in one. People will mix and match. There are people, this is the entire survey for that year that we analyzed. And what we found out is that some people are only in facility activity, some people are only in facility work. But if you look at where those overlap, there's people doing 2, 3, 4 things sometimes at a time. So people are mixing and matching what they're doing. So in other words, somebody might be going 1 day a week to work at a job, and then the rest of the week they're going to one of those community activities or one of those facilities. Whereas somebody might be going to a facility 1 day, and then might just be going to a community activity the other day. So what you can learn from National Core Indicators here is that individuals with intellectual disability are not just doing one thing. It's a mix and match for many of them. When you break it down by their primary activity, so we kind of broke this down and said, okay, there's a lot of overlap here. What are they primarily doing? So we kind of used a hierarchy here to kind of code based on favoring that community-based work. You can kind of see here that 27% are doing some kind of community-based work. 16% are doing facility work. 21%, a pretty good chunk, are doing just community activities. So these are unpaid, but they're out in the community. And then this is not necessarily surprising. I was a little surprised by this. 35%, the primary activity they were doing was just going to a facility, just doing something there that was work-like, but unpaid, separate from the community. So 35%, that's kind of their primary day activity back in 2022, so not that long ago. I mentioned here that we were trying to predict what kind of situation somebody with intellectual disability find themselves in. So there's a lot of findings here. The stronger results are the ones that are shaded darker. Here, there was a little bit of an effect of race and ethnicity in that individuals that were of African American background were more likely to be doing anything other than community integrated employment. The effect for the other races and ethnicities was not significant, except for a small effect there for those that were coded as Hispanic or Latino. They were a little bit more likely to be in facilities as well. Then if you look at the next grouping there, you can see that where it says moderate, severe, and profound, that is their level of disability. So profound is higher levels of disability, the highest level. And you can see kind of the shading there basically tells you that the higher your support needs are, so the higher level of your disability, the more likely you are to move towards facility activity or any activity that's unpaid. So the higher your level of disability, the more likely you are to be in something other than community integrated employment. So that was one of our biggest findings there. Being of older age and younger, not surprising. So the closer you get to more retirement age, the more likely you are to not be in community integrated work. And younger people aged 18, they start off not as likely being in work. So they're not starting off out of high school, jumping into community integrated employment at age 18. That's they're doing these at least as intermediate steps here, some other day activity. Verbal ability. If you are nonverbal, if an individual with intellectual disability doesn't speak for themselves, they're more likely to be in any setting other than community integrated work. If you have a behavior need, you are more likely, if you're female, you're more likely to be out of community integrated employment. If you have behavior needs or a mental health issue, you're also more likely to be in non-integrated community employment. You're more likely to be in facilities or just activities during the day. If you have mobility issues, so basically if you have a comorbid physical issue with moving around, you're less likely to be in a community integrated job. And the last thing I want to highlight here is your living environment. So your residential setting where you live. The more, if you live in your own home, this is compared to living with family. Basically, if you live in your own home, you're more likely to have a community integrated job. You're more likely to be in the community with a paid job. The further away you are from the community, the more you live in an agency with more people. So the more you're in an institutional-like setting, you're more likely to be in a facility of some sort, whether paid or unpaid, relative to living with family. So those group homes that get bigger and bigger move you away from community integrated employment in terms of how likely you are to be in that ideal situation. So that's what you can learn from the National Core Indicators data set. So our recommendations basically is to have more information, as said before, have some national standards about collecting this information so we can compare how different state programs lead to different outcomes. Having more person-centered data. There's not a lot of information about how people, how they like their job, if their job is a good match for them, if they feel like they're included in their job. Asking people with disabilities, do people treat you like you're part of the team? We're missing a lot of that information, so we don't know the quality of people's jobs from a person-centered perspective. And of course, longitudinal data, so following people over time. Everything you saw here is what's called a snapshot. We can kind of look at trends over time, but we don't have information that follows individuals over time and looks at the effect of policies and them getting services and seeing if that leads to more long-term community-based employment. So more information about that would be useful. So the final conclusion here is that policies have changed to support employment in the United States. We have indication from our data sets that that has impacted employment in a positive direction. And more information about this community-based employment would be helpful so that we could target services and policy to get people better jobs and more sustainable jobs that match their goals. And that's all. Thank you.
All right, thank you, James. So James's presentation was kind of the same level as the presentation that Jan and Susanna were doing for the European Union. So a lot of overview statistics, which are important contextually. So comments, questions for James?
So, James, thanks for a great presentation. If you mentioned quality, how would you go about measuring quality for the kinds of outcomes that you're talking about, the types of jobs they have, the quality of the interactions they have in the community? Do you have specific recommendations? I mean, your study probably didn't gather that, and that's what you said, but do you have recommendations for how we might begin to capture better quality data around the types of work that's done with people with intellectual and developmental disabilities?
Yeah, I mean it would, I think you would link it with the service system at the state level. So it's kind of a, having some standards. A lot of a lot of the people that I'm talking about are on those state HCBS waivers. And each state is required to track some sort of quality as at a state, but there's not a lot of uniform qualities that CMS is putting out there about that. I mean, some of their tracking is just the number of cases closed within a calendar year, for example. So sort of requiring states to talk to people with disabilities on an annual basis, kind of develop an ongoing longitudinal data set. And part of that would be asking questions like, are you working the number of hours you'd like to? So basically it would be more person-centered data collection, where as much as possible you're getting it from the people themselves. Are the services matching your needs in terms of employment, for example? So that it would be kind of like matching that with the service system and making it more person-centered and longitudinal would be the recommendations. Which there are efforts to do that, by the way, here at the University of Minnesota. We had a research and training center outcome measurement that's still ongoing. That's exactly what we've been trying to do. Is ask those kind of questions and kind of link that with the state service systems.
All right, thank you.